Well, we've been talking about mental health, and Saturday marks World Mental Health Day. So, for more on that, let's go ahead and bring in Dr. Gregory Jantz in Seattle. He's an expert on behavioral disorders and addictions. He's also an author. His latest book is titled Healing Depression for Life. And Dr. Jantz, thanks so much for joining us. You heard there in Jim Spellman's report, in terms of mental health, given what has happened with COVID-19, is there a precedence for what we're seeing on this scale?
You know, honestly, we're breaking all records, such as high levels of depression, anxieties at all-time highs. What we know, and addiction is on the rise. So we're really seeing more and more folks, they're really on the edge of despair.
What about the potential long-term mental health effects? I mean, after there's a vaccine, after there's a reopening, people go back to work. I mean, we've talked about lingering physical health impacts, but what about lingering mental health impacts that we should possibly be bracing for?
Well, we're going to have long-standing addiction issues because what has happened is addiction is on the rise, alcohol in particular, and so that's going to need to be treated. But what we're going to find is people who have suffered from post-traumatic stress disorder and obsessive compulsive disorder, this is going to be a long-standing issue. So the mental health issues will not go away, and I think we're going to find those in parallel with a lot of physical issues. So healthcare and mental health, get ready. We have an epidemic within this pandemic.
What is your advice for those struggling now?
Well, one of the things is people either have a chance to reset some things or they're going to regret. So what we need to do is don't wait. People tend to wait way too long to get help. There's good opportunities to get help. We're seeing people all over who are saying, yes, I don't want to live in despair. Suicide rates, I haven't mentioned that yet, but they're skyrocketing. So what we need to do is be willing to ask for help. There are resources available, and let's not wait where we're going to regret the addiction and regret really prolonged suffering.
I want to talk about some of the resources that are available.
Yes.
Oftentimes we see women and people of color and the poor disproportionately affected. Are there resources specifically geared towards those groups, and if not, should there be?
Well, I think that we need to have more resources. One of the things is we may need to make a decision. Today, I'm going to reach out to, maybe it's 2 different places or 2 different resources. I'm going to find out what is available. So often people are in such despair that they're not, reaching out, they're not finding out what's available. We maintain referral resources all over the country. So we're a resource rich in that we know who and who's treating what and how to get help.
I often think about American individualism in this context. Being how individualist many Americans are, was that a recipe for disaster in a situation where there's a lockdown?
I think one of the things is there's issue of pride and or shame, which says, first of all, I can handle this on my own, or secondly, I'm so shameful that I'm in this place that I'm not going to ask for help. And that's the place where we end up having a lot of regret. My word today is do the basic self-care. This is the time we've got to be, movement's important. We've got to be drinking, that other word for that is exercise. But we've got to take care of our physical health. Water, good nutrition, our sleep. We also have somewhat of a sleep epidemic happening, and sleep disorders are on the rise.